I sure miss my laptop. All right. Yes, people just make you feel like you ain't nothing. I'm not recording. Probably not. I need this to be recorded. It's recording. All right. I'll just say do what I'm gonna do is talk today. I know when kids get out of school, they're gonna be like this and that. I miss my desktop. I miss doing my lives on my desktop. Good afternoon, everybody. This is Remarkable Queen of Inspiration, the founder of On-Time Ministry, TCS 1000, the Love Ministry. This is the webinar entitled The Cancer Series. We'll be talking about pancreatic cancer, colon, ovarian, kidney, lung, liver, breast cancer that spread cancer. The cancer I'm talking about in breast cancer is metastatic breast cancer, and my name is Latricia Johnson. Pancreatic cancer. Here's the website on this. Hold up. https://www.cancer.org/cancer/pancreatic/cancer. Today I'm just going to share the links with you because I've done a lot of talking this week, and I just wanted to give you the information and to give you a little background about somebody I knew that had pancreatic cancer and passed. You know, pancreatic cancer can lead to a lot of alcohol use. And if you drink a lot, that affects your pancreas. And when you drink a lot, it's soaking up your pancreas. And when it's soaking up your pancreas, it causes other issues. And when it causes other issues, it causes your pancreas to enlarge and have a mass on it. This is why those who consume a lot of alcohol, I encourage you to cut back, because when you have pancreatic cancer, it's a pain that you don't want to ever experience nor want to feel, because you can barely keep anything down because you're throwing everything back up. Two, for those of you who consume a lot of sugary things, your pancreas is where you produce insulin. And if that's not functioning properly, you have it's a serious issue that you have to face when you don't save yourself from those type of episodes in your life. Do pancreatic cancers happen genetically? I'm not an expertise on that. It may. You just never know. It may happen. It may not. But from my experience, those who have who drink a lot of beer, a lot of stuff that's not good, can affect your pancreas. When you drink so much alcohol, you're abusing your pancreas because you keep gulping it down. Your pancreas is soaking up the alcohol that you're putting in it, and it's eventually going to kill it. It's eventually going to start to die. That way, you're going to have a lot of long-term issues in terms of that. And those of you eat a lot of sugar, your pancreas, again, you have to be careful with stuff you put in your mouth. So it goes from the alcohol to the food you intake, because your pancreas plays a very important part of role of how your body is functioning, in terms of, is it producing enough insulin? Is it getting enough minerals to reach every aspect of your body? So your pancreas is a very important part of your body. I need you to understand that, okay? Coronary cancer. I knew somebody that had that and passed away from it. Apparently it was a genetic thing. Fellas, encourage you to get that chest checked out. And the website for that is https://www.cancer.org/latest news, signs, symptoms of colon cancer. It's best to get screened and have early detection of it. With that, colon cancer, basically, if it's a generic thing, you might want to get it tested as early as possible to see if that, are you at risk to having colon cancer if it's a generic thing in your home, in terms of, excuse me, not your home, in your family, to be aware about that. The earlier, the better to prevent long-term issues over time. And this is why people do colon cancer screenings and make sure everything is okay down there. Next link. Ovarian cancer, https://www.cancer.org/cancer/ovary cancer, detect, diagnosis, signs, staging, signs, and symptoms. With ovarian cancer, again, get screened early. And a lot of times they like to do a screen because they can detect it when you go for your pap smear. And if your pap smear comes back abnormal, and that ties into what I was talking about last month about HPV and cervix cancer. When you go through your pap smear, they'll detect, oh, do you have ovarian cancer? Because the cells that they take from your uterus, ladies, determines whether it comes back positive or negative. And two, when they look at the screening and something don't seem right about the tissues and where it looks, they want to do further testing to see what is it. Is it a cyst, or is it a cancerous problem that needs further testing and evaluation? So if you have history of that in your family, by all means, get the help that you need. And they have resources out there. Log on to this link if you know somebody's going through that. Allow the process to take course and learn as much information as possible about ovarian cancer, okay? Kidney cancer. https://www.cancer.org/cancer/cancer/cancer, detect early stages, signs, and symptoms. With kidney cancer, you have to be careful how you are taking care of yourself. And it always, and two, a lot of them be like, remarkable, I'm doing all right, everything is good, but how did I end that? How do I end up with it? Excuse me. Like I said in the last two slides, it can be a generic thing, or also too, it may not even be in the history of your family and you end up with kidney cancer. And that's just as bad as all the ones I was talking about, because it's interfering in your bladder system. And if you see something that's not quite right about your urine, or you're having pain and it's had an unusual smell, or you just not peeing properly, whatever the situation may be, by all means, go get yourself checked out. It'll save you so much heartache and pain. Hold up. All right, let me go back. Oops, hold on, y'all. I'm going too fast today. Let me go back. All right. Lung cancer. Let me go back to my presentation. Lung cancer. I know someone who passed away from lung cancer. Lung cancer can be generic, or it can be due to a lot of smoking you have been doing over the years, and it's causing you to have so much inflammation in your lungs. You may have lung cancer in both lungs. You may have lung cancer in one lung. They determine that the simple fact that if you have a knot somewhere, or if you start to coughing and wheezing and shortness of breath, and you start to coughing up blood and stuff that you're normally not used to, you need to get that checked out. And when they find out what it is, and do a complete biopsy of your lungs to see that you have whatever stage of lung cancer that you have. I encourage you though, those who smoke, cut back. Those who are around secondhand smoke, by all means, if you're around somebody who smoke a lot, make sure you wash your hands, change your clothes. Just Do the best you can to save yourself when you're around secondhand smoker. And the worst cigarettes I would say is the non-filtered ones. And even the non-filtered ones are bad, but all cigarettes are bad. And somebody gonna get on this webinar talking about remarkable. I'm gonna do what I do. It's not about this, everybody. This is about educating you to preserve your life a little longer. That's what this is about. I'm not telling anybody how to live their life. I'm just encouraging you to think about long-term results. How would that affect your loved ones? And how would that really play out for them while going through that stage? I've experienced people who had lung cancer. I experienced people who had, I knew somebody who had pancreatic cancer. I knew somebody who had colon cancer. Don't know anybody who had kidney cancer or ovarian cancer. But I do know somebody who had lung cancer. And the different cancers I'm talking about, I have gotten a lot of education on these factors, okay? Liver cancer. This is why you have to take care of your liver. You definitely have to take care of your liver because your liver is just like your pancreas. It all has important parts of your body. Get tested, whatever you have to do to make sure you preserve your liver. Your liver is on one of these body parts here, your pancreas over here. So by all means, save your liver. Save your liver by all means. I mean, you have holes in your liver, it's like, oh my gosh. It is not a good situation. It's just, at times, some people can get transplants. Sometimes. The chances, who knows? But all I know is everybody, please take care of yourself and make sure you get yourself checked out and find the resources and information. If you don't have health insurance, there are resources and places that you can get tested or evaluated. And the website I give again is right there, and they'll be able to hopefully direct you. It depends on what state and location you may be in. But this information I'm sharing with you today is very useful, very helpful, and very informative. I have the links right here that I'm sharing. I'm not going in further detail today. I'm kind of just giving you just a summary about each of the cancers because it's a lot of cancers. Metastatic breast cancer. The website is https://www.us.kisqali.com/metastatic breast cancer about MPC. What is metastatic breast cancer? Metastatic breast cancer is when cancer is in the breast and is spread through your entire body. That's what metastatic breast cancer is. If you have history or genetic things in your family, by all means, I encourage you to get tested. It's a must. I encourage you to get tested. With metastatic breast cancer, it can become very aggressive. And when I say very aggressive, it can go from one part of your body to the entire part of your body. That means you cannot function and you're not going to be able to walk. You're pretty much bedridden. Okay? So here are the links that I'm sharing with you all today. Let me scoot my screen up real quick. So we have the first one is https://www.lynparzapcacp.com. This is the first link. The next one is www.vectibix.com/metastatic colorectal cancer resource. I'm gonna leave this up for a few minutes for everybody to kind of take a picture of it and kind of just say, man, what does all this look like for me? What does this mean for my families or family members or friends? Those who are going to just look at that resource, and I'm just gonna let that sit there for a few seconds before I slide to my next presentation. All right. I got a couple of videos. Let's just see if it's gonna let me be great today, y'all. I don't know. Let's just see first. All right, we're gonna start off with the pancreas and then the other ones. Hopefully these videos will play for me. So let's see.
Pancreatic cancer, treatment and outcomes. Pancreatic cancer affects the pancreas, a digestive system organ located in the upper abdomen. The pancreas has two important functions. It produces hormones to regulate blood sugar and enzymes to break down food. Treatment of pancreatic cancer is divided into two approaches: curative and non-curative, or palliative. Curative treatment is possible for localized tumors which are amenable to surgical removal. Most pancreatic cancers are in the head of the pancreas. Tumors in the head of the pancreas are removed using a surgery known as the Whipple procedure. In this surgery, the head of the pancreas, the distal bile duct, and some of the small intestine are removed. It also involves some reconstructive surgery. A Whipple procedure is a major surgery that takes 3 to 5 hours and typically requires a 7 to 10 day hospital stay. The operation is best performed by specialized surgeons. If the tumor is in the body or tail of the pancreas, a distal pancreatectomy surgery is performed to remove these parts of the pancreas, as well as the spleen, and sometimes part of the stomach. Very rarely, in the case of large or multiple tumors, the entire pancreas is removed, together with the gallbladder, part of the bile duct, the duodenum, and part of the stomach and spleen. Reconstructive surgery is then performed. Following surgery, chemotherapy is given to help destroy any remaining cancer cells in the body. Radiation treatment may also be used to target remaining cancer cells in the pancreas. Recovery after surgery can be slow. Following a Whipple procedure, the stomach empties more slowly, which can result in nausea, vomiting, feeling full quickly, and poor nutrition. However, this improves over time. As well, infections and leakage of pancreatic juices are common during the healing process. Weight loss over the first 3 to 4 weeks following surgery is typical. If the tumor is not operable, then treatment is non-curative or palliative in intent. Rather than attempting to cure the disease, the goal of treatment is control of the disease, extension of life, symptom relief, and maintaining quality of life. Chemotherapy and radiation may be used to slow progression of the cancer, and medication to manage pain is common. Long-term outcomes following curative treatment vary immensely. Even after successful surgery, chemotherapy, and radiation, pancreatic cancer returns in most cases. Between 15 to 40% of people who undergo surgery live for 5 years or more. However, on average, the cancer returns in about a year, and survival is between 1 to 2 years post-treatment. Nutrition is important in both curative and palliative treatment plans. Decreased appetite and feeling full early are common. As well, the pancreas loses its ability to work well. This may affect how nutrients are absorbed from food and its ability to regulate blood sugar. To help maintain weight and nutrition, the treatment plan may include pancreatic enzyme replacement therapy, PERT, nutritional supplements, and appetite stimulants. Dietary changes to reduce the amount of fat in the diet may also be recommended, as well as increased frequency of small meals or snacks.
Dr. John Kissel and the team at Mayo Clinic prefer to see patients screened for colorectal cancer before they show symptoms.
We want to try to bring patients in who are not having any symptoms.
But what if you have symptoms?
Patients may have abdominal pain. They may have difficulty for stool to actually move past a narrowed area where there's a colon cancer, and they may have altered bowel habits as a result.
And when it is colon cancer,
it often means that the disease will be more difficult to treat.
There are typically 4 stages of colorectal cancer.
They are governed by the size of the tumor, whether or not the tumor has grown into an adjacent organ that's near that location, whether or not there are lymph nodes that the tumor has spread into.
Lowest stages indicate cancer that is limited to the lining of the inside of the colon.
Stage 4 is where the tumor is actually spread out of the bowel and into distant organs.
Dr. Kissel says while there are treatment options,
we wish more people were being screened.
For the Mayo Clinic News Network, I'm Dee Dee Steepen. Dr. John Kissel and the Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it's spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers, so listen.
All right, everybody. The first 3 videos that were shown was pancreatic cancer, colon cancer, and ovarian cancer. Okay. The next 4 videos are going to talk about kidneys, liver, lung, and metastatic. So we're going to do the kidney cancer one.
Cancer that would spread. Small renal masses are among the most common kidney tumors urologists see in clinic. Small refers to solid tumors 4 centimeters or less, and 4 centimeters is about the size of a golf ball. If we removed all of the 4 centimeter tumors, we know that 20 to 30% are benign tumors, and of the cancers, the vast majority are low-grade indolent tumors, meaning a benign behaving cancer. Certain characteristics can change those numbers. Women are more likely to harbor benign tumors, and the smaller a mass, the less likely it is a dangerous tumor. For masses smaller than 2 centimeters, the risk of that being a kidney cancer that would spread from the kidney is less than 1%. For a 3 centimeter mass, it is about 1 to 2%. And for masses greater than 4 centimeters, it can be 5 to 10%. Given the understanding that most small renal masses are not dangerous, there are a few options for management of these tumors. Many patients choose surgery, and this can include surgical removal, freezing or burning of the small renal mass, and preservation of the kidney, and in some cases, removal of the entire kidney. An alternative to surgical options is active surveillance. Active surveillance refers to careful monitoring of both a patient and their small renal mass to make sure that it is not growing or changing in a dangerous way. Urologists at Johns Hopkins are among the leaders in active surveillance for small renal masses, and the DISSRM registry, Delayed Intervention and Surveillance for Small Renal Masses, or DISARM, has been open since 2009, cataloging the outcomes of hundreds of patients who chose to follow their small renal mass rather than undergo surgery. Since 2009, we have learned that most small renal masses, about 80%, grow very slowly or not at all. Some small renal masses will grow at a suspicious rate for aggressive cancer, and we do recommend surgery in about 15% of our patients. Importantly, no patients have had kidney cancer spread from their kidney, and no patient has died of kidney cancer in our program. Active surveillance involves periodic imaging with either CT scans, MRI, or ultrasound. and annual laboratory testing to ensure general well-being and kidney health. Imaging is typically recommended every 6 months for 2 years to establish a baseline growth rate, and then annually thereafter if a small renal mass remains stable in size. Renal mass biopsy, urine tests, and molecular imaging can be used to guide management in some patients. At Johns Hopkins, we recognize that not all small renal masses require immediate surgery, and we work with our patients to develop an individualized plan for active surveillance to keep a close eye on their small renal mass and ensure their overall good health.
In this video, we will cover the function of the liver and how cancer may arise. The liver is located in the upper right of the abdominal cavity and lies directly beneath the diaphragm. It is the largest glandular organ, measuring approximately 20 centimeter in length, 15 centimeter in depth, and weighs around 1.5 kilograms for adults. The liver can be divided into two, a right lobe and a left lobe. Blood vessels and bile ducts also define the boundaries of 8 separate segments. The liver is the only internal organ capable of natural regeneration of lost tissue. As little as 25% of a liver can regenerate into a whole liver. One of its most important functions is to produce bile. This collects in bile capillaries within the liver. Some is stored in the gallbladder, where it can be discharged into the duodenum and small intestines to aid digestion and break down fat. When the food is fully digested, the resultant fat, sugar, proteins, vitamins, minerals, and all other nutrition is absorbed into the bloodstream and transported to the liver for processing. Some nutrients, such as sugar, are retained by the liver and released if the body requires additional energy. The liver stores a multitude of substances, including iron, copper, vitamin A, D, B12, and vitamin K. It also produces coagulation factors that are critical to cessation of blood loss from damaged vessels. Due to its wide range of functions, the liver is absolutely essential for sustaining life. Another important function of the liver is cleansing blood. Liver cells break down toxic and extraneous substances found in the blood and discharge them by means of excretion or urination. Initial symptoms are often ambiguous, such as weight loss, poor appetite, inflated abdomen, lethargy, discomfort in the upper abdomen, and fever. Often, the tumor has grown significantly before being discovered. Liver cancer is currently very rare. Yellowing of the skin and eyes are a clear indication of failure in the liver or gallbladder and should be examined by a doctor. A first examination involves palpating the abdominal area to check for enlargement of the liver, and a blood sample is taken. Suspicious findings entail further examination. Blood tests, ultrasound, and CT examination are often sufficient to determine a diagnosis. Primary liver cancer originates either in the gallbladder or liver. However, the majority of cancer instances are a result of spreading from other organs, in particular the stomach and intestines. Cancer cells can separate from the tumor and be transported via the bloodstream to the liver, where they can attach and establish secondary sites. If the tumor is not too large and the remaining liver tissue is healthy, surgical removal is often possible. After the excision, the liver can regenerate back to full size within a few months.
This video is sponsored by Health Journey Support, a free website where patients can learn to manage chronic diseases by watching 3D animations. Please visit healthjourneysupport.com to learn more.
You or someone you care about may have been diagnosed with lung cancer. This video will help you understand more about lung cancer and how it affects your body. Your lungs are a pair of organs inside your chest that allow you to breathe. You inhale oxygen, which all cells need. Then you exhale a waste gas called carbon dioxide. This gas exchange happens inside tiny air sacs in your lungs. Lung cancer is a disease in which normal lung cells change into harmful, abnormal cells called cancer cells. Cancer cells multiply to form clusters called tumors. These tumors grow and destroy healthy lung tissue. Lung cancer may spread to other parts of your body through blood or lymph fluid, a natural substance that helps gather unwanted waste material from your body. There are two main types of lung cancer: small cell lung cancer and non-small cell lung cancer. They are named for the kinds of cells in the cancer and how they look under a microscope. Non-small cell lung cancer is the most common type of lung cancer. Small cell lung cancer is the most aggressive type of lung cancer. It grows and spreads more quickly. The most important risk factor for lung cancer is smoking. Other risk factors include breathing secondhand smoke, exposure to radon, having a family history of lung cancer, HIV infection, exposure to harmful chemicals such as asbestos, and air pollution. Lung cancer may have no symptoms in its early stages. When symptoms do appear, they may include chronic cough, chest pain, trouble breathing, coughing up blood, hoarseness, loss of appetite, trouble swallowing, weight loss, tiredness, and facial or neck swelling. If you have lung cancer, your doctor will need to determine the stage or progression of the disease to help plan your treatment. Non-small cell lung cancer has many stages. In the occult stage, cancer cells are found only in lung fluids. In stage 0, abnormal or cancer cells are found in the lining of the airways. By stage 1, a small tumor is found. Then in stage 2, the cancer has grown or spread to nearby lymph nodes or non-lung tissues. In stage 3A, the tumor has grown to any size. In addition, cancer is found in lymph nodes on the same side of the chest or in nearby organs. Stage 3B is similar to 3A, but in 3B, cancer is found in lymph nodes on the opposite side of the chest. Cancer may also be found in lymph nodes above the collarbone. In stage 4, tumors might be found in both lungs. Additionally, cancer may have spread to distant organs. There are fewer stages for small cell lung cancer. In its limited stage, cancer is found in one side of the chest only. In the extensive stage, cancer has spread to the other side of the chest or to distant organs. As you deal with a diagnosis of lung cancer, continue to talk to your doctor and your cancer care team.
Most cancer deaths are caused by metastatic cancer. Metastasis occurs when cancer cells break off from the original tumor, which is also called the primary tumor, travel through the body and begin to grow in other tissues and organs. Metastasis causes death by damaging important organs, such as the brain, lungs, and liver. Cancer cells continually break off from the primary tumor. Some of these cells may move into nearby blood vessels and lymph vessels. Cancer cells can travel along these vessel highways to other parts of the body. Many cancer cells die while traveling through the blood and lymph vessels, but some may survive and stick to the vessel wall, then move through the vessel wall into another body tissue. These cells may then divide and form a metastatic tumor. Where are cancer cells most likely to spread? Cancer cells tend to spread to certain places in the body depending on the site where the tumor first formed. For example, breast cancer tends to spread to the bones, lungs, liver, and brain, and colon cancer tends to spread to the lungs and liver. It's important to remember that a metastatic tumor is the same type of cancer as the primary tumor. In this example, colon cancer cells have traveled through blood vessels and formed metastatic tumors in the liver. These metastatic tumors are colon cancer, not liver cancer. Metastatic colon cancer is usually treated with drugs and other therapies used to treat colon cancer. Researchers at the National Cancer Institute and other research organizations are studying metastasis and ways to prevent it. Preventing metastasis will help prevent many cancer deaths.
Thank you for watching the Love Ministry webinar, educating people and giving them ideas and information that they can share. Until next time, take care, everybody. My name is Remarkable Queen Inspiration. Have an amazing and safe and blessed weekend, everybody. I'll be back on here again next month with 4 more webinars. Take care.